What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for December 1, 2020. COVID-19 transportation safety, holiday and everyday travel and autonomous vehicles. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Dr. Colleen Berry, the Chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with Dr. Mark Rosekind, a distinguished policy scholar at the school. Dr. Rosekind served as administrator of the National Highway Traffic Safety Administration from 2014 to 2017, and prior to that, he served on the National Transportation Safety Board. They discuss traveling safely during the winter holidays as COVID cases surge and protecting the health of people working in the transportation industry. They also talk about the future of transportation, the promise of autonomous vehicles, and what it could all mean for fighting the next pandemic. Let's listen.
Mark Rosekind, thanks so much for joining me today on our Hopkins podcast. We have entered the holiday season and families have lots of questions about how to travel safely. As a leading national transportation safety expert, what are the key principles that everyone should keep in mind for safe travel over the winter holidays in the context of the COVID pandemic?
There are really three things. First and foremost is to do the basics that everybody's hearing about. Wear a mask, wash your hands, social distance. Every day, check your systems, your symptoms. Make sure those self-assessments are telling you whether you need to get tested or talk to someone, etc. Do the basics. That's the first thing. Second is transparency, which is explore whatever mode you're thinking about to see what they're doing to actually keep you safe. So if they're being transparent about cleaning protocols, signage, you want to know about those things before you ever travel. And the third thing is have a plan. Don't just get on the road by whatever mode of travel and hope that things are going to be okay. So make sure that you actually have a plan for if you're driving, where you're going to stay, how you're going to fill up with gas. What are you going to do to keep yourself safe throughout an entire trip?
So let me probe a little bit. Is it possible to travel safely regardless of the mode of transportation? So planes, trains, automobiles. Are there, in fact, more or less safe ways to get around?
So let's look at that from sort of two perspectives. One is absolutely there are safe ways to travel. And I think if you do the three things we just talked about, you put yourself in a good bubble to be able to move yourself even during this time. But I think the second part of that question, what you're doing is going to the fact that there are differences between the modes that we travel. So there's now some pretty good data showing that traveling on an airplane is pretty safe as far as risk goes for exposure, as far as the air filters and how the compartment is set up, et cetera. It changes whether or not there's somebody in the middle seat though, right? And so really what's critical again is have a plan and explore. So whatever mode that you're using, you'll know what procedures are in place to try and keep you safe during this time.
So what about public buses? Many people, particularly those with fewer financial resources, rely on public transportation to get back and forth, including from work daily, including now during the pandemic, of course. Also about kids riding on school buses. What do we know about safely riding a bus right now?
So let's first talk about the transit aspect of this, which is really critical because so many essential workers, and finally we have a real focus on what essential really means. And so many of those people, especially in different communities of color, et cetera, public transportation is critical for them to get to and from work, et cetera. And it's critical to go and explore what that particular transit or public mode is actually doing to keep people safe. So do they have specific cleaning protocols that they're actually telling people about? Do they have requirements for wearing masks? What's the social distance procedure that they have in place? You need to go learn what those are. And I say that because there can be differences in what's going on. So having been in touch with some people that run very large transit systems in the US, I can tell you they're doing a lot of good safety protocols to make sure people are okay. Now, is everybody doing that on every bus in every city? That's the part where you have to explore, for your particular bus line, are they doing what they need to help protect you during this time? So there's a little work on your part. And again, we're back to that transparency to make sure that you have actually access to figure out what's being done to help keep you safe. And the same thing is the school buses that you're talking about. Again, there's some school systems that are both transparent and have a lot of procedures in place. And there are other places that I would bet there may not even be, mask requirements or other things. There's such diversity right now in how people are approaching this. But the key is if you can find out, you need to explore so you know what's being done. Make sure you do what you can control, the mask. So do that for sure, and then see how much more protection is being provided by these systems.
But it's okay for us to go and ask. It would be fine for me as a parent to go and ask the questions I need to have answers to make sure my kid's safe on a school bus, sounds like.
Oh, not just fine, but you should absolutely do that. And in fact, I think it's a big red flag for you if they don't have it. It's like, oh, we can't give you that information.
Yeah.
Or, I'm sorry, those are confidential. Or no, that's a procedure. No, that would be a big red flag if they're not willing to share with you what protocols are in place to help protect you, your kids, et cetera.
That's great. So let's talk a little bit about policy. I think we all want to get people moving again. And there was a time period where we really weren't moving at all. We saw that from the data, but that's changed. Can you give a sense of where we are in terms of mobility? But then importantly, what policies we might still need to get people moving?
There's no question that there's just a huge opportunity for us to make everybody safer if we were to establish clear federal policies that are consistent and based on science. I mean, it's just like absolutely clear. And I say that because the United States Department of Transportation has modal agencies for every mode of travel. And so if we have department and mode consistent procedures, wear a mask, this is what's required for social distancing, making sure that there are sanitizer and other kinds of things that are available, the transparency that we're talking about. So a lot of things that we just discussed could be so much easier if, in fact, there were federal requirements that everybody knew were being applied every place in the country. So the kind of things we just talked about, it may not apply to your particular school system or the particular bus line that you're on. If we had federal policies and requirements for cleaning protocols and, again, mask protocols, those kinds of things would make it so much easier for everybody to know, here's where the bar is. And for sure, you shouldn't even have to ask. Right? You should know that bar is being met in your local transit or school system.
So let's switch gears. In addition to being our 5th Hopkins Distinguished Policy Scholar in the Department of Health Policy and Management, you currently serve as the Chief Safety Innovation Officer at Zook, an autonomous vehicle and on-demand transportation service startup company. Did I pronounce that correctly?
Yeah, it's actually called Zooks.
Zooks. There you go. So I want to get, in the context of this role, get a snapshot from you of what transportation might look like in the future. And then I want to get at this question of how what may seem like futuristic concepts such as autonomous vehicles could be relevant for our response to the next pandemic. So let's start with the first part of that question. Give us a snapshot of the future of mobility.
So as administrator at NHTSA, you're basically the chief safety person for roadway safety. And so I made everybody in the agency know the number. What was the number? Well, for 2019, 36,120 lives were lost on U.S. roadways. That's 100 lives every day. It should not cost you your life to go to work, to go to school, to go to a healthcare provider. It shouldn't put your life at risk for those things. And so this is, and I'm sure we'll talk about it more, but it's a huge public health risk. And what's interesting is we started a group called Road to Zero, which did some future forecasting. And with RAND Corporation came up with a great report that says in 30 years, we could have 0 deaths on our roadways. How do we get there? Well, we've got to emphasize what works. We got to push safe systems even harder. And we have to advance new technologies. And so anybody interested, not just in autonomous vehicles, but the new technology, it is the new tool we have to start saving those 100 lives every day. And people talk about it in three areas: safety, mobility, and sustainability. And so we've just talked about the safety opportunity of saving lives, preventing serious injuries, preventing crashes. The mobility opportunity is also very large. When you just think about the number of people over 65 that still have their keys to the car and are going to lose them at some point. When you look at the disability community, many folks who are already challenged will never have a driver's license, etc. That's over, when you put those communities together, 100 million people in the United States are affected by those kinds of issues. And sustainability, it ends up in every city, about a third of the greenhouse gases are actually related to transportation. So even one of those is worth us pursuing new technology. But the chance to actually enhance safety, mobility, and sustainability, that's what the future opportunity for transportation looks like. And I think we're going to see some of those in the near term, but probably over about a 20 to 30 year time frame to really see major opportunities benefiting our entire society.
Okay, so let's put this new mobility conversation, which is so interesting and exciting and obviously important, together with health security and this conversation that we've been having in the context of mobility and COVID. It's clear from the health security community that when it comes to thinking about the next infectious disease pandemic, it's not a question of if, it is a question of when. So what might new mobility mean for our ability to tackle future public health crises? What could that look like?
I think there are two obvious ones that could be so significant. First, you have somebody who's symptomatic or tested positive, and a fully autonomous vehicle with no driver pulls up at your door and basically delivers you to a healthcare facility for your treatment. No other human beings are put at risk in that transport. Okay, so it's amazing to think about that, right? And so that's one. A second one is what we've learned in the current pandemic is that, delivery is an infrastructure requirement. We've now learned that FedEx, UPS, Amazon, you name it, these companies and what they're doing have been critical for making sure that people can stay home, stay protected, and still be able to get access to things that they need. And so I think those two are just big. We can move people around without putting other humans at risk, whether it's to a treatment facility or in other kinds of contexts. And two, there's a chance to actually deliver packages autonomously, again, not putting humans at risk. So I think those are two examples of where new technology in a future pandemic could be very beneficial.
And we know that second group are where we see both real concerns about health disparities and risk of COVID-19 and real ongoing requirements for financial reasons of staying in this workforce. So that's great. Really important and interesting for us to think about for the future. I want to, for my final question, get at this question related to how transportation connects to public health. And we've touched on this really throughout this interview. But I think some of our podcast listeners might be surprised to hear about a segment on transportation on our Johns Hopkins Public Health podcast. Can you share your take on why transportation is a public health issue?
Well, and I'm going to give you credit, for actually talking and tackling this, because so many people don't make that connection. But it's 100 people losing their lives a day. It's one in the United States. It's 1.3 million globally. And the number of injuries, again, in the United States, it's over a couple million every single year, in 6 million crashes. This safety on our roads is a huge public health risk. A really fascinating article, Ashley Halsley III, Washington Post, did an article last year. Over the last 20 years, we've lost almost 100,000 more people losing their lives on our roadways than in both world wars. It's just it's amazing to think about these losses. And again, that's not even the injuries that people are suffering. And in certain age groups, this is the number one risk, health and life risk is on the road. And so if we don't connect these, we are missing a critical opportunity for us to try and address, this issue that can save lives and prevent very significant injuries.
So a great opportunity maybe for our students to think about saving lives through smart transportation policy with a public health orientation.
Absolutely. And one of the things I like to point out, tragically, is that while we often talk about different morbidity and mortality and changing behavior, et cetera, In road safety, we lose lives instantaneously. Just one time, speeding, drunk, drugged, distracted, drowsy, etc., and you miss braking or something else happens, you lose your life literally in seconds. And so, often in public health, we think about long-term, lifespan kinds of things. In road safety, it's death, and life, and literally in moments. And so, I think that severity needs to be part of this conversation, and why public health really has a role to help improve road safety that hasn't been fully appreciated or realized.
Mark, thank you so much for joining me today on the podcast.
My pleasure. Hope we do some more.
Let's do it.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.